Thank you, Beth. And I'm gonna. My name is Ann Harris, and I'm the. I'll tell you a little bit more about my role, but I'm the LEND director, and are coordinating and emceeing this presentation that will really be like a panel of people that have been involved in our LEND transition planning or transition consultation process that we did this year. And the goal is that you'd understand what we did, which is describing the LEND program transition consultation format, and that from our family and youth presenters, you'll learn why they would want help with healthcare transition planning and what they learned from that process. And that as a result of that and the information and perspectives shared by the LEND trainees and faculty involved, that you would be able to use one or more of the strategies, the things that we learned to help families with healthcare transition planning in the work setting where you are working. So those are our objectives, and I'll tell you just a little bit first about the LEND program. So the next slide shows basically a group shot of pre-COVID of several years ago, and our group of trainees. The LEND is the word LEND stands for Leadership, Education, and Neurodevelopmental and Other Related Disabilities. So it's a very long program title, and we do call it LEND for short. So the program itself, and you can go to the next slide, is funded by the Maternal and Child Health Bureau, which funds all the children and youth with special needs programs in Wisconsin that are funded by the block grant. So it's the same funding source and the same kind of vision statement that we're going to improve maternal and child health in our nation by improving access, equality, integration, accountability, and equity. And so this HRSA and Maternal and Child Health Bureau funding to the LEND program is to train leaders and that can do these things in the community. So next slide says that we have a 5-year training grant at the Waisman Center for the LEND program. It involves over 30 faculty, and this year over 50 trainees. And we have affiliations with 11 departments at UW-Madison and 5 at UW-Milwaukee. Again, I'm the director for the LEND program in Wisconsin. There's just one in the state, and also for the Youth Health Transition Initiative. So in those combined roles, and because of the LEND program curriculum, so you can move to the next slide, we wanted to really focus on transition from pediatric to adult healthcare as one of the curriculum components. We do use a lifespan approach. The trainees are involved in a number of different activities over the year that totals over 300 hours of training. Some of it's didactic, some of it's experiential. And we've been working on an experience to help both faculty and trainees work with families on transition planning for a couple of years. We had planned an in-person consultation model. We'd worked with some families through the Waisman Center clinics and had some trainee and faculty teams working with those families when COVID-19 hit. So we converted to remote, and the next slide, I just threw in a picture of one of our teams of trainees and faculty that met this year, so you can see what LEND looked like. But you can move to the next slide. I'm going to focus now more on what the transition consultation process looked like for the trainees and the families that were involved. So what we did was set up an experience for small interdisciplinary teams. And thanks to Jacqueline Bender, who's one of our LEND faculty in occupational therapy, who's on this call as well, but she is our consultation coordinator. And since she works in both the Waisman Center clinics and for the LEND program, she was able to work with clinicians at the Waisman Center to recruit families of youth that were 14 to 17 years of age and had expressed interest in some help with transition planning. And then we've also added a transition expert or resource person with faculty and 2 to 4 trainees from different disciplines. And this year, those trainees represented disciplines of OT, occupational therapy and physical therapy, psychiatry, public health, special education, and psychiatry. Maybe I said that, psychiatry and psychology. So the teams met 4 times, and the first one was where Jacqueline would share information that the family had provided to the team, and planned sort of the questions around transition planning that the team wanted to ask. And again, all this is done remotely this year. The second meeting was with the family and youth to find out more about what their questions were and more about a day in the life and how, where they were in the transition, even thinking about transition and the transition planning process. And again, focused on healthcare. And then the third meeting of the team was without the family to sort of respond to what the family had said and the youth said that they needed and wanted out of the consultation, to look at appropriate resources and referrals. And we have kind of a repository of materials that we draw on for these teams. And then the fourth meeting was with the family and youth to share the recommendations and have the family make a plan to on what they really wanted to do next, what was their next step. So this was a multi-part consultation process, and it would involve learning and resource development, as well as learning how to work, interview families, how to work with families, how to listen to families and youth, and then how to tailor recommendations and resources to those families' needs. So that was the basic outline, and I'm going to now invite, I had one more slide, sorry. We had 9 trainees participating in spring semester and another 5 or 6 last fall, but the evaluations were very positive, and both in terms of what the skills and experiences the trainees said they learned, and how achieving our goals for working with families and having them understand a little bit more about what families need and want at this stage in their lives. I think what I haven't mentioned, and I don't have a slide, but we can now turn off the slides because I'll be talking with Sandy Tierney, who's our parent. But the follow-up I haven't mentioned. Follow-up for the families really is happens after a couple of weeks, and then again 3 to 6 months later. Jacqueline has been following up with families, but since we've only been doing this for this last year, we're still gathering information from families, so I don't have that to share with you. So next, we're going to hear from one of the parents that participated in the consultation with the trainee and faculty team. And this parent is very unique, and it's wonderful to introduce Sandy Tierney to you. She has experience as a LIN trainee, as a family parent trainee, and also works with our LIN program in another role designed to help trainees learn from families. But in this case, and she'll tell you more, she was serving in the role of parent to Lauren, and you'll hear from Lauren as well. We've recorded Lauren's presentation, but first we're going to find out a little bit more from Sandy about why she wanted to participate. So Sandy, can you describe the process from your perspective, or why did you want to participate, and what were you hoping the team would address?
Sure. We were just getting started thinking about transition. Lauren turned 15 this spring, and we realized things take a long time. We need to get moving on them. We'd been hearing for years that transition was a process, and so it was nice to have that background knowledge that helped us know to get started. Also, I think we were a little bit spurred on by the fact that I know enough that school should be doing some transition work with her as well, and that really hadn't been happening. And I asked them about it, and I felt like, oh, I'm having to be more involved than I had anticipated. And so it just made me realize maybe there's more that I'm going to need to do. And so it was really nice to have an opportunity to have that help, to feel like, oh, there I'm getting the support our family needs to kind of work on that transition piece, that I wasn't going to have to be doing it all on my own.
Yeah. So who was on your transition team?
We had an OT, we had a nurse, social work trainee, a rehab psych trainee, and a psychiatry trainee.
Yeah, great. So a lot of different disciplines.
Mm-hmm.
And did the team, I'm confining a few questions here, but how did they help you identify what you and Lauren and I think, I don't know if your husband participated in this as well, but how to focus the consultation, and then sort of how hard was it to focus on healthcare versus other things, like you mentioned, the school.
Yeah, I think it was really helpful that Jacqueline and I had a phone conversation where she really kind of laid out what this was so that we could come to it realizing it was exclusive to healthcare, but that she also was able to kind of acknowledge that she realized as a family, we don't think of our child only in terms of healthcare or only in terms of school or only in terms of something else. We see them as a whole person. So it was nice to have that acknowledged, but then to also say, for this purpose, we're going to focus on this piece. And I think that orientation helped us stay on track, realizing what this was going to be and what this wasn't going to be.
Yeah, and so did the team, what kind of questions, or what kinds of specific things around healthcare did you end up focusing on? And then we'll hear from Lauren about how some of those things were addressed.
Yeah, one of Lauren's questions was insurance, which I thought was really interesting. She's very proud of her knowledge of her insurance coverage. She's been checking herself in at appointments as early as she could. And that's been a really important thing to her. So she's aware of insurance. So that was one of the things she wanted to know about. I'm more of the approach of, I want a long view. I want to know sort of how far we have to go, what kinds of things we have to do, and so that we can be planful in when we're ready to work on what. I feel like the more knowledge we have about a process, the more we can make it fit our life and our schedule. And then that allows us also with her therapists and with school to target things that would help support her learn the skills that she would need at various time points. And so that was another piece that they really helped us with.
Great. So do you have anything else you want to share with us before we watch Lauren's recording?
I'm trying to think. I guess, I don't know if it would be helpful to know a little bit about Lauren. She is now 15. She has cerebral palsy, as well as some other diagnoses like ADHD and low vision, a nonverbal learning disability, and kind of some other things going on. So she's kind of complex. She's got needs in a variety of areas. And so I think that makes for her a lot of pieces that need to be thought through. She's medically stable, so we don't have to think about that typically. But, you know, those are pieces that we had to kind of think through what's important to her individual situation. And I think that was a nice thing that this consultation did, is they really thought about us as a specific family and her as a specific individual and those needs.
Great. Good. Well, thanks for that introduction. And I think now that Catherine can play the video, so I will mute and we will listen. So I think it's about 10 minutes.
Is everyone seeing that?
Yes. And there we go. Now it's full screen.
Okay, great.
I could learn more about the adult system, because I've always been in the kid system. Even though I could use my dad to help me learn about this, because he's also a doctor, I wanted to learn about it all early so that we could get the process started, because I know how long processes can take to do this kind of stuff. I was hoping to learn more about how the adult system are compared to the kid system, so they could help my own healthcare transition more. Listened to me really well. I was pretty surprised about how much they came back with after the first meeting. The way my mom and I think about it is if we help the team understand more that they can help me better, but not just me, other people like me better in the future. Or look at it like we want to have like another person, like if they need to have like another doctor to learn like things we're totally okay with people watch so they can learn how to give me and other people like me the best care they can. I would have done it without internet asking because I know how much it helps other people, and I just want to be able to help myself and other people like me. I think the wording used would be for everyone, but maybe you might have changed to words they know instead as much medical. And then you could say what the medical word is if they want to know, so they're not confused when a medical provider uses the medical word in the future. They could use the medical word, but then explain in regular people words, not physician words, that what it actually means, and then they could still say, so it relates to this word, so that someone whose parents isn't a physician has medical vocabulary, but then also knows what it means without the medical term. They did a great job of finding resources for that, how different programs that we could go through and different things we could look at. Talked and focused on what we wanted to know about the transition. What I wanted to know about the transition. They also sent us something that says a timeline. At this age, do this. At this age, do this. And one of the things they said is have your parents be in the room, but you do a lot of the things. So I have a baclofen pump, and so I actually didn't have mom in the room when they were refilling it. I held my hands above my head, and my mom used to do that for me so that I wouldn't touch my baclofen pump. When they were actually refilling my pump, she wasn't in the room. But at the start, to help get me on the table and all the scheduling, then she was in the room. And my personal caregiver, Brooklyn, who is hopefully going to be a pediatrician someday, are going to all look at the materials that the team gave me for healthcare transition. This isn't related to healthcare, but this summer, my camp banquet would usually be going on, but it's virtual this year, and I'm not doing it, but I'm doing a UCP teen camp and at Aspire, another place that I do therapy for OT. I'm gonna do the Next Steps program along with daily living skills, and one of the things I'm working on is cooking, and they're gonna work on cooking and doing my own laundry, so it's not just the healthcare stuff that I want to work on. It's also that kind of stuff. In school, I'm taking a class called Your Money, and then next year, or maybe the year after that, I'll take Managing Your Financial Life, and they're even doing a culinary class in school. And so I'm not just doing healthcare transition planning, I'm doing full-on transition planning. I'm gonna do some transition stuff with my OT Emily at Aspire. So first, on Thursdays, we're doing on Thursdays. I think I'm doing 1 hour of daily living skills with her, which I'm working on cutting on my own food with an adapter cutting board that has little spikes that I can put the food on. I'm also working on dressing using a dressing stick and a reacher and that kind of stuff. But then the next steps group will work on more like cooking and doing laundry and that kind of stuff. It depends how long we have my chart, so we can always talk about it all in my chart if she doesn't have enough time to do like a big talk about it. Because I know with COVID right now, it's really busy in healthcare. Not just in healthcare, but a lot of other things. And, what we're talking about, like, as a mom and dad and mom and I, but we do go up to Gillette, which is a specialty children's hospital, because my old dear pediatric orthopedic moved to Nebraska, and and he was neuromuscular, so I don't know if I'll be spending time alone with Dr. Guillaume or Dr. Navat there, because it's more specialized stuff, but definitely probably at my primary. But there was an opportunity, even like the healthcare training opportunity, to plan for your future before it comes to be, so that you can start actually planning, because I know how long planning can take, especially in the healthcare. So it's good that we could start young, and I really hope, because I have personal coaches who are OTs, that this keeps going on, and that this keeps going on, because I think it would be helpful for other kids that don't just have special needs, but for kids like my typical developing brother, Alex, too. Like people, or like parents, to see what they can help with teaching their kids before they're 18 and just have to go straight to the adult world. I don't know, it's really hard to think, because I think it all was really helpful. So I think it will be really helpful when I'm older, especially with having a lot of different types of doctors and personal care workers who take me to my appointment, along with my parents doing video calls.
So thank you for playing that, Catherine, and Sandy will get you back up here for a sort of a reprise and some, but that was just amazing the way Lauren is so articulate, and she had a lot to say. That was an edited version of our interview with her, but she touched on so many important concepts, and I was trying to keep up with her, and I know because it was an edited version, and Catherine was still seeing you, that's okay, but we might want to pin Sandy here. So she talked about learning and teaching others and training health professionals, which is again part of what the LEN program is about. She talked about concepts like health literacy and plain language and the process and time frame for transition and how healthcare fits with all of the other things that she's planning to learn and do. And then she talked about, the team approach and then specifics around having time alone with the provider and her primary versus specialty care transition needs. So I just thought she had so much to say. And as Beth said, every time we hear this, we learn more from Lauren. So thank you. And thank Lauren for sharing her expertise. She's in school now and wasn't joining us in person, but did the pre-recording with Sandy and Beth. So Sandy, getting back to you, I maybe have missed this question earlier, but doing this transition consultation, we'll get into some more of the specifics, but did it reduce your anxiety or worry about this process?
Yeah, having the resources pulled together sort of for us that were specific to what our personal concerns are makes me feel like I don't have to go out and try to sift through, first of all, locate and then sift through. I know there's a ton of stuff out there. I just don't necessarily know where to find it. I don't know how to interpret it as well as I would like to. And so it's just really nice to have that kind of curated for us. One of the things I really appreciated was when the trainees were talking about a particular resource, it wasn't just the name of it and, oh, it does this. It was a really nice full description, and then how that resource would specifically fit for what we were looking for. And through that process, I learned that an agency I'm aware of that I thought only did this portion of things does all this other stuff that would definitely benefit us and be of interest. And so they kind of, by doing such a nice job, they helped me identify my misunderstanding of something. And I think it's really easy when names get thrown out all the time. Oh, you're familiar with this and you're familiar with this, to not realize that depth of understanding isn't necessarily all there. So that was extremely helpful to know that they were able to really speak to what that agency does, that they dug deeper. They didn't just provide a name from another list. They really understood the organization and helped me understand what it could do. So at the same time, my husband and I are like updating wills and trusts and all this because my parents just moved into kind of a retirement assisted living situation. And we're like, oh, we should really rethink some things. And so this has come really nicely at that time because we were thinking, wow, if anything happens to us, who can step in and do pieces? And now I feel like this helps pull pieces together so it's not as daunting and overwhelming for someone who would have no experience in the developmental disability system, because, we've already picked my husband's brother or his sister, but, they also have healthcare experience, but not developmental disabilities experience. So it really feels like this would be a nice gift to them if needed, that this information would be consolidated.
Good. So let's talk, I know you had a few reflections. Is there anything else you wanted to share about Lauren's video or her role in this consultation process?
She feels very empowered, as you can tell. She has tried to keep us on target. She has been like, she said to my husband, she's like, Dad, we need to sit down and look at this together, because she wanted me to do it with her. And I said, I think Dad should be a part of that conversation. But unfortunately, he's been on call so much, we haven't been able to carve out that time. But she is like kind of on us with that, which I think is wonderful that she's taking that responsibility and she's feeling empowered. And part of that is because some of the suggestions were specific to exactly what she wanted to learn more about. And so I think that by really hearing her and providing that information, it just really made her feel more a part of this. And I had asked her if she wanted to be a part of the Zoom calls, and she's like, yes, it's my healthcare. And I was like, perfect, and the team was very on board with including her.
Yeah, she's always been a strong advocate. So this is, you can see how her growing, again, autonomy and independence and what she wants to do. She has plans.
She has plans, and Linda's one of them.
Yeah. So could you, I have sort of two other questions. One is, and again, I know you've prepared some comments, but more about the process and sort of like how it was to meet twice. And the other was, and you can address, I think, in the same response, what, as much as you're willing to share it without getting, too personal, what exactly did you end up focusing on? Like, what were the questions and the resources that were provided around us, you know, kind of the idea of where the team was trying to meet you where you need the
Right.
information you needed at the time you needed it. So what were those goals at this point and when she's 15?
Yeah, one of the things that I really liked, and I'm pulling out my sheets right now to help me stay on it, is that by meeting a couple of times, I feel like it gave them a better chance to get to know us and what we were looking for, but then also to respond to that. And so initially they presented 4 or 5 different areas. One of them, so the things Lauren was interested in was insurance and some self-advocacy with healthcare providers. That was really important to her. Because I don't know as much as I need to about like independent living stuff. That was another piece that they provided information on. And then we talked about supported decision-making as another big piece because, you know, we've already had that conversation with her. So then they were also able to say, okay, if you only have this amount of time, or your first step, what do you think would make the most sense? And as we had that conversation, we really came up with kind of some more moving on kind of workshops through Love Inc. So Lauren learning sort of more skills for herself. And then the other real big thing, which I think was really more for me, was the timeline, the GOT transition timeline. I just feel like that really fits my style of learning about things, having that so we can figure out where we want to do. Because we started, when I think back on it, really transitioned with Lauren when she was very, very little. We have always said that it's your body. We're not in it. We don't know what it feels like, but we need you to be able to explain to us. And to do that, you need to know the terms for things. So when she was 3, she knew that the inside of her elbow was the antecubital fossa. I mean, she's very proud of that, you know, and I think that starting early, introducing it in bits and pieces, I think that really helped. And we have that advantage because my husband's a physician and he has quite a few patients who do have disabilities. So we were fortunate that we had lots of models to kind of think through how do we want her to be able to participate in her healthcare as an adult as we watched her grow and learn those skills.
So my final question, because I think our time is, we need to move on, but was there anything challenging about participating in this process?
I don't think for us, because we are so oriented towards healthcare, I think it might have been more challenging if someone was less open to healthcare and had maybe some more personal healthcare things that they were less comfortable talking about. Lauren talks about things that maybe should not always be shared. She's very happy when they learn certain units in school to share things that I'm like, oh, okay, that was your choice. You know, I would not have shared that. So I think that could be challenging for some people. It's not for us. I think now the challenge, it's not a big challenge, is that Lauren's going to hold us responsible and accountable. And I think that's great, but it's also like, ooh, okay, we got to get moving on this. So, and I mean, I love that she feels empowered to do that.
Great. Well, thank you so much for sharing your experience. And I know that every family is different. So we appreciate your experience and learning from your experience. And we're going to move on to trainees and that worked with a different team and a different family. So I'm going to introduce 2 of our LEN trainees, Sarah Park and Yasmin Castruita Rios. And Sarah, I'm going to start with you. If you could just introduce yourself, your discipline, and maybe who was on your consultation team and the role that you took in that consultation process.
Of course. Thank you for having me. So my name is Sarah Park, and I'm a second-year master's student graduating this August from the Rehabilitation Counseling Psychology program here at UW-Madison. Our Wednesday spring semester transition consultation team consisted of 2 faculty members and 4 LEN trainees. Yasmin, who's the other LEN trainee here with us, and I were both on the Wednesday team, and we are both from rehab psychology. She is in the doctoral program, and we also had a student from public health and a student from occupational therapy. Our faculty who held the host and transition support role were from different disciplines of blend OT and family. So our team really did come from diverse disciplines. As I just mentioned, faculty held the host and transition support role, and the 4 students, we each took on different roles within the team. Yasmin took the facilitator role. She took the lead in creating the interview questions, led the information gathering during sessions with the family, and guided the flow of the conversations and questions. We also had a wonderful scribe role who recorded important information on this scribe document provided by our faculty host. Another student and I, we took on the capturer role. Our role was to summarize the team's findings and areas to focus on, to provide recap of the discussions that happens in consultation teams, because we also meet separately in the meetings, and then provide those summaries to the family. And since there were 2 of us, one of us took lead capturer role in different sessions. Aside from these different roles during transition meetings, each student also individually contributed to the consultation by researching and gathering resources that the family requested or things that we thought family might benefit from.
Great. Thank you, Sarah. And Yasmin, can you introduce yourself and describe in general terms, because we're not going to give any information, personal information, but the family that you worked with and the youth and their concerns, or the topics that you decided with the family to focus on for your consultation?
Yeah, definitely. So hi, everyone. My name is Yasmin Castrita Rios. As Sarah already talked a little bit, I'm a second-year PhD student in rehabilitation psychology. And I was first-year trainee that played or had the role of a facilitator. So kind of just some brief information from the family that we got to work with. So the youth was 15 years old at the time that we were meeting with them. This family was I would say, unique situation in the sense that her legal guardians were her grandparents, which I know it's at times not very typical. And her grandparents had been her legal guardians for the past 2 years. The youth that we worked with had a variety of medical conditions or diagnoses, with some being autism, epilepsy, intellectual disability, muscle weaknesses. But again, these are just a few of like others of the kind of diagnoses that she had. And then some of the resources that they were already involved with or were already receiving included the Children Long-Term Support Waiver, Medicaid, and they were fortunate also to just have a case manager, which was also kind of helping them a little bit with like understanding the whole transition process, but they still had questions. So some of the questions that our host kind of communicated to us before even meeting them were a lot tailored in like what transition was. They specifically kind of asked like what triggers it. So we could kind of already get a sense that like they had really a lot of questions in regard to how transition works, when it ends, when it starts. And then just giving her medical conditions, they also had questions in regard to like their specialty care providers and kind of how that changes within the transition process. So when we met with them, we pretty much just had interview questions to get to know them better and maybe have like a better understanding of like, let's say a medical condition or any specific concerns they may have if it comes to safety, or just like when thinking of the transition process, but more in the healthcare aspect of it. So after we met with them for the first time, we identified certain like needs per se, and like they had to do with the legalities of that transition to adulthood. So in instance, like custody versus guardianship, because they did identify that they were not sure what the difference between those are. And then just kind of given that the youth had like a vision limitation, they were a little bit concerned on how they could support her better so that she could be more independent in, let's say, like the simple act of like crossing a street by herself. They also had a little bit more questions in regard to independent living, the adult care provider transition, and that entails also a little bit about like the disability benefits, and then just kind of like different ways that they could engage more within their community and such. So at the end of the day, we provided them with a variety list of resources, but we always ask them to make it easier for them to kind of focus on, like, let's say 2 to 3 within the next month, so that it's less overwhelming for them. So they decided to focus a little bit more on like a particular document that talks about how you could better develop a relationship with your provider. Like, what are some, let's say, it was kind of a document where like you write down specific information of the youth, so that when they meet a new provider, it's kind of like an about me sheet of paper handout, if you can think of it that way.
Yeah.
And that's excellent, just giving the fact that she's meeting someone entirely new. And then just kind of other resources in regard to better understanding transition. But in a nutshell, that's kind of some of the information we provided. And just to echo Sandy, we did ensure to any resource that was provided, we showed it to them virtually, but then we at times specified the page, because saying page, just focus on page 5 is easier than saying, here are 20 pages and all of this is going to be helpful. So again, we just wanted to avoid overwhelming them with information.
Yeah, great. Thank you for that description. Actually, I'm going to ask, it's a little bit out of order, but Yasmin, I'll ask you, what then stood out as the main thing that the team did for this particular family consultation?
I think a lot is really, first of all, like getting to understand where the family's at and what are the questions that they have. So because we could have come up with like 10 things that they had questions on, it was, as a team, we really needed to think of what's like the stuff that we should prioritize the most, just given the situation that the family was on. So having so many different disciplines, I think that was nice to make sure that we were thinking of every aspect rather than like only, you know, on a specific like lens and such. So I think that that really helped ensure that we better supported the family in the situation that they were in.
Yeah, great. Thank you. And I know since transition's a process, I know we often think we have to give the family everything all at once, but really it is a sequential, and so prioritizing and focusing step by step is really helpful. So Sarah, did you feel that participating in the process helped you learn about healthcare transition, and what, you know, from the family and youth's perspective versus, I guess I'll say more sort of a textbook or a case-based learning?
Oh yes, most definitely. So as a rehab counseling psychology student, I study different aspects of people with disability, life of people with disability, and how to improve quality of life. And my main research interests are in transition age youth with intellectual and or developmental disabilities. And before LEND, I feel like I mostly focused on employment and post-secondary education outcomes, but practicum experience through LEND and the Youth Health Transition Initiative, I feel like I learned a lot about healthcare transition and healthcare side of things. It was, I think Sandy also mentioned GOT transition, like the healthcare transition map and the timelines. Those were really helpful. And then also learning about like different benefits and when to apply for which one to avoid gaps. Those are really important questions that we really all should be looking at in addition to employment and post-secondary education. I think it was great to have some of the questions that we really should be asking starting age 14 and all throughout that transition period. And I think that also there was a question about family perspective. And I think from the family's perspective, I think the biggest concern may be having questions but not knowing who to go for what. Because like we were talking about, transition is such a big topic and there are different areas of transition. Like for example, healthcare transition is one area of transition. I think maybe sometimes families don't necessarily know who to go to for which questions. So I think our consultation team did a really good job. Even though we had a healthcare focus, we were able to pull from different things and make those connections for the family and with the family. So that was, I definitely learned a lot.
Great, thank you. And a really good point. And we do have a project working on those integrated transition planning, but it is hard because they, you know, sometimes get siloed. So my last question, and if you could both just address this briefly, is, and then we'll move on to Julie, is Did you feel you had expertise to help them, or if you learned something? I mean, what in particular supported your learning to feel that you could help this family? So you could start, Sarah, and then if Yasmin has anything else to add.
So like I was saying, our initial goal was to focus on the medical transition of the families, but we found that many of the transition topics really overlap and a lot of times are intertwined. Like, for example, we're thinking about adult healthcare. We do end up talking about things like who makes those decisions, which leads into topics like guardianship, supported decision-making. And also we have to think about how we're going to pay for that, which leads into questions about insurance and maybe benefits and long-term care. So I think I had a bit more expertise when it came to talking about some of these topics that are perhaps not necessarily healthcare treatment providing and clinical experience, but like where are we going to get the insurance? How are we going to where do we find the services? So I think that's maybe where I had a little more expertise or had studied these topics and related to my department. So I think that's where it was for me.
Great, thank you, Sarah. Yasmin, do you have anything more to add here?
I think just on my end, and it's more of a personal thing, given like the training I have received on school, I feel very comfortable like engaging in conversation or like just kind of building rapport with individuals. So me being the facilitator with the team, I think was a great decision just to kind of help with that kind of specific task. And I guess just a big shout out to like Jacqueline that organized everything, and then also like our other like faculty member, because they really helped us whenever we had specific questions. And then the fact that we already had like a library of resources was very helpful for us, for it was kind of a way of receiving that support to make sure that we were looking at the most common or like most informative resources per se.
Great. Thank you so much to both of you. And our last panelist, if we will, is Julie Hajuski, who's not only a member of the Youth Health Transition Initiative staff as our adult nurse practitioner, but also was working with the trainees on a consultation team. So Julie, you're going to kind of bring us home here, but could you talk about some of the tools and strategies from this consultation model that you think other clinicians could use or use to help their patients? And also address a little bit, if you don't have a whole team of interdisciplinary professionals to help you, how you could sort of hone in on the essential elements or where to get help and pull into to helping families.
Absolutely. Thanks for the introduction, Anne. And I always, whenever I listen to the students, and I think, oh my goodness, we learn just as much from them in a faculty role and our families. I've learned so much through this process, but I think it is always, I'm always looking at how can we then apply it to the bigger picture of practice. So when I'm not at the Wiseman Center, I'm in a clinic working with patients. And so the pieces that I always that have really fallen back on, those strategies from this consultation that I think can be really helpful for our clinicians that are listening. One of the huge resources that I always try to talk about is our regional centers. We have so much expertise in our INR specialists and our regional centers, and so many places that families can go and get information through the regional center. So I always try to remind myself that that's a great tool from this consultation that I've cultivated. Our youth health training initiatives. So through the Youth Health Transition Initiative, we have a couple of trainings that are really key to the health transition for youth, and that's Build Your Bridge, which is a great training for families. I know with Sandy and her consultation, I was working with that team, and that's one of the things that we talked about. And that particular training also has a new modified version called Build Your Bridge for some of our more complex youth with complex healthcare needs and cognitive disabilities, to help more so from the family aspect when we don't have Lauren to drive that boat.
And that modified curriculum for children with complex needs is called Dreaming Differently.
Oh, thank you. I'm sorry, I said that wrong. distracted. Thank you, Anne, for correcting me. And I think one of the other consultation tools that is just so helpful for clinicians, as many have pointed out today, Got Transition really has a well-developed website with a lot of resources. And their family toolkit that they introduced last year is phenomenal. So if you're looking for that one-stop, something to give families in clinical practice, that family toolkit can be really invaluable. When I think about what parts of this essential element do I take forward and I use on a regular basis, and I think other clinicians can think about using in their practice, that well-cultivated library of resources can be so helpful. So just like Yasmin and Sarah had mentioned, you know, we came into this with a library of resources. We didn't have to go do that research. That can be so instrumental in practice when you're working in practice. You don't have time to go sit down at your computer and dig up 10 resources. But you can take time and do that. And then when something comes up, you have that resource that's key for that issue. The other thing I think is really, really essential for practice is that champion model. So just like our teams had a resource person on there and a faculty person that they worked with, when you're in practice, finding those champions in your organization that you can go to. I have this issue with this patient. This is who I know my resource is on that to go to. And I think the other essential element of this transition consultation is, as we've discussed many times already today, start early. I don't think there's any such thing as too early to introduce that concept and to help cultivate that. Just like Sandy, you'd mentioned with Lauren, that we started very young with introducing those concepts of transition that can only benefit families in this process.
Yeah, great. Thank you, Julian. And I'll mention a couple things that I thought of as you were talking. One is that I know when we're looking at resources within our organization, we often, you know, for clinicians, there's sometimes resources buried in something like the education components that you can add access to the electronic medical record or even some website links. So I know that that's available, at least at UW Health, they have some transition resources there. But Julie can actually help you find those resources in your organization and also the champions. So we are trying to cultivate champions for transition in a variety of different healthcare systems in Wisconsin. So if you know of some that you can help us find those, and if you need to know of some, maybe we can help you find them. So we're working both ways there. And now I think we'll open it up to any questions that our participants might have. So any of the speakers, we can go back to gallery view, and then I think Beth was probably going to prompt you to do the evaluation. That's I think the link is posted in the chat, and we'll take some questions for any of our panelists. Well, if we don't have questions from the group, Jacqueline, are you still with us?
I am.
There you are. Hi, thank you so much
Hi.
for all of the work supporting both the families and the transition teams for LEND. It's been an amazing journey. Could you, from your perspective of having talked to all the families that we've done this process with, tell us sort of some of the challenges as well as the benefits that you see that the families you know, in working with the families, because I know at first when you first contact them, like, you know, they may not know what they're getting into.
Yeah, absolutely. I think that is probably one of the biggest challenges is starting the process and kind of laying the groundwork to help them understand, first of all, what this consultation will look like, but also just kind of wrapping their brain around the transition process in general. I think also this is just a really sensitive topic for a lot of families too, where families have expressed like, we just got a hang of the healthcare system for pediatrics. And now we have to kind of approach this really big monster in our life again. And that's hard. So I think having something that is concrete like this can be really beneficial for families. It's been really great to see each family gain more understanding over the course of the first time I reach out to them to that last session with the entire team. And across the board, families have just shown a little bit more understanding, have been really appreciative of the support that we're offering. One thing that I've learned is that I feel like I'll meet a family and I'll say, oh, this is a really unique family, or, oh, this is a really unique situation, or this is a really unique youth. And it just reminds us that every youth and family is unique, but everybody goes through this process. So it's been a learning process for me as a provider, that this is incredibly important no matter what their situation is.
Great, thank you. That's really helpful. Anybody else have a question? If not, we can have our last slide if you need to put it up, Beth, or just again wrap up the learning community call.
Yes, thank you, Anne. So I just want to thank the presenters. I learned a lot today, so I really appreciate your giving us your time. We do have a QR code on this slide that you could scan to fill out the evaluation, and also the link is in the chat. We hope that you will join us for our next learning community on September 9th. And thank you very much for your participation today. And this concludes our presentation. Everyone have a good day.